Heart disease, vascular disorders by Megan Long, Rakita Merritt, Kelly Messenger, and Felicia Perry.
We chose the peripheral vascular system to illustrate ways to improve cardiovascular health. We chose this particular niche of the cardiovascular system because there are signs and symptoms we often see with the naked eye and some techniques for evaluation that can be done during a routine head-to-toe assessment.
The vascular system, also known as the circulatory system, is made up of a network of vessels that carry blood and lymph through the body, delivers oxygen and nutrients to the body tissues, and carries away waste matter. The vascular system functions as an important component of other body systems. The three main components of the vascular system are the arteries, veins, and capillaries. Arteries transport oxygenated blood from the heart to the body. Veins transport deoxygenated blood from the body back to the heart. Capillaries are tiny blood vessels between the arteries and veins that distribute oxygen-rich blood to the body. Peripheral vascular disease is a condition that causes restricted blood flow to the arms, legs, or other body parts. Some causes of peripheral vascular disease are atherosclerosis, which is buildup of plaque, arteriosclerosis, which is changes in the structure of the blood vessels, blood clots, vasculitis, which is inflammation of the blood vessels, trauma or injury, or it could simply be genetic. Symptoms of peripheral vascular disease include claudication or cramps related to walking, discoloration in legs or arms, hair loss on legs, skin that is thin, pale, or shiny on the legs and feet, slow healing wounds or ulcers, thickened toenails, slow or absent pedal pulses, heaviness or numbness in the muscles, and atrophy. Risk factors include age, obesity, lifestyle choices such as smoking, drug use, or an unhealthy diet, medical and family history, pre-existing health conditions, and race and ethnicity. Treatment for peripheral vascular disease is based on the underlying cause. Some doctors may recommend that the patient exercise regularly, eat a balanced diet, quit smoking, or start medications such as anticoagulants, statins, or ACE inhibitors. The doctor may also recommend surgery such as angioplasty or vascular bypass surgery.
Peripheral artery disease, or PAD, often has no signs or symptoms, but it can cause a range of symptoms from leg pain while walking, to skin color changes, to ulcers, or even gangrene. Arteriosclerosis is the most common disease of the arteries, and it is the stiffening or hardening of the artery walls. Atherosclerosis is a type of arteriosclerosis. It is the narrowing of the artery due to plaque buildup. A key note here is that if you have these buildups or blockages in your extremities, you can also have it in other parts of your body, like your brain or heart. This is a reason PAD increases your risk of stroke or heart attack. What are the risk factors for PAD? Well, first, there's sedentary lifestyle. Sitting for long periods of time is associated with heart disease, type 2 diabetes, and cancer. It can lead to an increased BMI, increased waist circumference, hypertension, and hypercholesterolemia. Staying active throughout the day and 30 minutes of physical activity 5 days a week for the average adult can lower your risks. Second, smoking. According to the CDC, smokers are 4 times more likely to develop PAD. Chemicals in tobacco damage blood vessels, and your body's effort to heal can lead to plaque buildup. Next, diabetes. It is a whole body or metabolic disease, so there are changes of chemistry in the body, and it can narrow blood vessels. When thinking of this, you can consider diabetic neuropathy or poor healing. That shows the decreased circulation. Also, hypertension and high cholesterol. Too much cholesterol can lead to buildup of plaque, and it can restrict or block blood flow. Hypertension can lead to atherosclerosis too. Remember, there are no symptoms, so regular blood pressure screenings and regular checkups with your PCP are important. And finally, age and obesity both increase your risk for atherosclerosis and heart disease. The more risk factors a person has, the higher the risk overall for cardiovascular disease. Regular checkups and screenings are important for monitoring, and you can lower your risks with a healthy diet, regular physical activity, medications if necessary, and smoking cessation or decreased alcohol intake. As nurses, assessing a health history and vital signs, skin color, temperature, edema, looking for ulcers or rash, asking questions about pain, especially while walking or at rest, looking at hair and nails can tell a lot for circulation, and palpating peripheral pulses. Teaching is also a very important role as a patient advocate.
Megan just reviewed vascular health of arteries. I'm going to talk about the venous system. We chose DVT as a good example of venous vascular disease. A DVT is a deep vein thrombosis or a blood clot in the deep veins, usually of the legs. Prevention of DVT are wear compression stockings or TED hose, blood thinners if indicated, losing weight, eating a healthy diet and exercise. Also, frequent stops while traveling to get out and walk will reduce your risk. Symptoms of a DVT include leg pain, tenderness with swelling, warmth, and redness. A DVT is a medical emergency and can lead to a PE or a pulmonary embolism when the clot will travel to the lungs. VTE, or venous thromboembolism, is a disease that includes both DVT and PE. We already reviewed the DVT symptoms, but PE symptoms are unexplained shortness of breath, rapid breathing, chest pain, which may worsen when breathing, cough, and have bloody pink sputum. Diagnosis can be done via a lab called a D-dimer or imaging such as a CT or CTA. Often VTEs occurs after discharge, and 80% of the patients diagnosed with VTE are critically ill. The Virchow triad are the three main areas that contribute to a clot: hypercoagulation, stasis, any damages or stress, hypertension related to the problem to the endothelial tissue. Another risk for DVT is phlebitis.
Lymphedema. Lymphedema is a chronic lymphatic disease that results in disfiguring swelling in one or more parts of the body. It can be hereditary, which is primary lymphedema, or it can occur after a surgical procedure, infection, radiation, or other physical trauma, which is known as secondary lymphedema. Signs and symptoms: swelling of part or all of your arm or leg, including fingers or toes, a feeling of heaviness or tightness, restricted range of motion, aching or discomfort, recurring infections, and hardening and thickening of the skin, which is known as fibrosis. Treatment includes: there is no cure for lymphedema. Treatment aimed at reducing swelling and controlling the pain. Exercises, wrapping your arm or leg, massage, pneumonic compression, and compression garments are all part of the ways you can treat lymphedema. Chronic venous insufficiency, or CVI. Chronic venous insufficiency occurs when your leg veins don't allow blood to flow back up to your heart. Normally, the valves in your veins make sure that blood flows toward your heart, but when these valves do not work, blood can also flow backwards. This can cause blood to collect or pool in your legs. Signs and symptoms: mild or immense pain, heaviness and swelling in the lower part of your legs and ankles, unusual and frequent itchiness, leathery skin, and visible varicose veins. Treatment. Treatment depends on the underlying cause identified and diagnosis. Simple cases can be managed by self-care measures. Use of medication is indicated in cases where the cause is a treatable medical condition.
Whether you're looking to improve your health for cardiovascular reasons or just to feel better, there are things to take into consideration. Risk factors could be genetic or they could be modifiable, and you can make changes today to start to lower your risks overall to improve your health and cardiovascular health. Eat healthy and get moving. Make sure that you keep your routine physicals with your PCP. There are great screenings like an EKG, an ABI, or life screening can also be done. Also maintain your cancer screenings if you are at that age. Here are some great things to get you started locally, some walking paths, hiking, different groups that you can join, also apps or websites that could come in handy.